Joining us right now is Dr. Merritt, a pediatric orthopedic specialist at Erlanger Medical Center. And we sort of talked about it right off the beginning. We're leaning towards non-surgical orthopedic care.
Yes.
And what is that in general?
So how I differ from a pediatric orthopedic surgeon, for one, I'm pediatric trained, so I'm trained as a pediatrician to recognize the stuff that normal pediatric doctors would see. But I did extra training in orthopedics so that I can manage one of the number one complaints to a pediatric office. So any kind of back pain, leg pain, knee pain, fracture care, club feet, scoliosis, you name it, I probably see it, and I probably will try to get you somewhere if I can't fix it.
And of course, the obvious thing here is that we're trying to avoid surgery. We don't want to see our little one going through surgery and dealing with that. So there are ways to kind of around it, but still give proper care.
Right. So we try to do, conservative management first. If it's not possible or, it's not working, then I can put them in the surgeon's hands and try to explain to them what to expect and have them build a rapport with our surgeons so that they can get the proper care they need. Now,
some of this care, does it differ from, breaking the old arm off the trampoline or the swing set, or as you mentioned, slides sometimes as well? They happen. We do break our bones too, but is there is that something different in care or that you guys do?
With the surgery versus non-surgery?
Right.
So with kids, we're very lucky that they can break pretty significantly and not need surgery, but there are some fractures in order for them to heal properly. They do need surgery. So I've been trained to recognize which one needs what. Typically in the ER, they're screened and sent to surgery if they need it and get it. But if they do come in the office, I had some hand fractures, actually my first week, that ended up needing surgery, and I sent them to the surgeon. So.
Now, you kind of rattled off a list of some of the things that you do see, anywhere from scoliosis to some back pain and leg pain. And I guess the parents that are listening, grandparents that are listening right now too, when is it a time that we need to come see you?
So I typically say whenever. I'm happy to see a parent whenever they're uncomfortable with something. I know a lot of parents will come and say, I'm just used to them so often telling me they have pain, so I didn't think anything of it. Whenever the parent feels comfortable, there's no fault in waiting, there's no fault in coming sooner. We can get you the treatment whenever you need it. And if it's not time, if it is too early, then I'm happy to say, hey, come back in a year, we'll see you, or come back in 6 months, or kind of guide that way. So.
And of course, it seems like with medicine or conditions, ailments, there's always a certain time of year for this or that, like flu right now. But are there certain conditions that you see at certain times of the year?
So typically we see fractures more in the summer when kids are out of school, out playing, out on playground equipment. We see that more seasonally than anything. Everything else is pretty steady year-round. So.
Now, are you working with infants as well?
I work from birth to 21.
And is there, you come in, you're sort of diagnosed and understand what the condition is. Is it still working with you through physical therapy, or kind of how that process works?
So I work with the physical therapist. I'll send them, refer them, and they are very good at communicating, two-way communication between us and them. They'll fax me the report, and we'll make any changes that are necessary. And even with orthotics, so kids that need different braces, we'll give them a call, kind of discuss, hey, I have this kid, is there anything that would work better than what I'm doing, and try to have a two-way communication. So we're very good at communicating with the physical therapists around town and the orthotics companies, which is very nice.
And I can only imagine how long this list would be, but preventative care, are there any sort of things that you want to tell parents? I know certain conditions require certain things, but with dealing with our kids and the amount of cases or type of cases that you see, is there any sort of preventative measures, or we just kind of have to let kids be kids?
Yeah, I think you have to let kids be kids. It's not fair to keep them off monkey bars or playgrounds because you're afraid they're going to break. Let them have fun, let them be active. It's really important for kids to be active, because then we have the issue with obesity if they're not active. If they break something, we'll fix it up, and they'll probably be back to going without any problems.
And, kids are resilient too. I think it amazed me when, unfortunately, my two-year-old, who was one at the time, broke her elbow, and the fact that she was able to be taken care of so quickly and heal so quickly. That's sort of a testament to both what kids can do, but also where medicine is today as well.
We find that kids typically don't push themselves beyond what they're comfortable with. So we have kids that have fractures that their parents even never knew happen, but they were able to not walk on it, and that's how they pick it up. So kids are pretty smart. They're not like adults. They don't push it.
Yeah, sometimes us adults can be knuckleheads, I know. All right, folks, for more information, Erlanger Medical Center, the phone number 423-778-LINK. Again, that is 778-5465, erlanger.org. And, of course, always the safe thing, if you're just unsure, give them a call. It's always better to check and be safe. Thanks a lot, Doctor.
Thank you for having me.
Folks, we'd like to say big